Hi there, I'm going to be talking about isolation, different types of isolation, different types of equipment, and how to take care of a patient in an isolation unit. First and foremost, I just want to talk a little bit about isolation precautions. We use standard precautions for every patient that comes into acute care. And standard precautions are universally used with any patient that comes into the hospital, in the office environment, clinics. And the assumption is this: any secretion coming out of the body, no matter who you are, is considered a potential contaminant. Because in sometimes we don't really know if a patient has a communicable disease or not. So anytime that a nurse takes care of a patient or is seeing a patient in the office or in the community, we assume that any secretions are potential contaminants, and we wear gloves. So we wear gloves. If they give you a tissue full of mucus, any secretion from the mouth, emesis, stool, urine, anything of that nature, okay, we will handle it with gloves. Other parts of standard precautions are also double bagging of grossly contaminated bloody. It has to be soaked in blood, dripping, or another gross contaminant that we would double bag in biohazard bags are when we recently, a while back, had Ebola. There was a contaminant. The contaminants were a lot of vomitus and diarrhea and stool. So that would have been double bagged. But for the most part, small amounts of wound drainage or peri pads for people who are menstruating are not considered biohazard material and wouldn't be placed in a biohazard bag. But that's part of standard precautions. Also part of standard precautions are sharps. The use of sharp box for all sharps, properly disposing of those. And these are some examples of standard precautions we utilize for everyone, every patient. Now, when we talk about transmission-based precautions are implemented for patients who have a known communicable disease or suspected one. So there are many that I'm going to talk about and many that you're going to learn about. But there are three main categories per the CDC, per the World Health Organization. And the three categories are your airborne precautions, your droplet precautions, and your contact. Now I'm going to talk first just a little bit about your airborne precautions. Airborne precautions are utilized when we have a very fine microbe that can be transmitted in the air currents. And as a result of that, this type of patient is placed in what we call a negative pressure isolation room. Negative pressure isolation, what it does is it pulls the air out. There's usually 12 air exchanges per day, and it ventilates the air in the room out. In order for the negative precaution room to be utilized, airflow, the door needs to be shut. Also, with airborne precautions, we wear what's called an N95 mask. The N95 mask provides an immense amount of protection, not only for exhalation, but for inhalation. Now, the N95 masks come in small, medium, large, and extra large. And in order for it to fit appropriately, you have to be fit tested. So when you have this mask that you place on your face, okay, when it's fit tested appropriately, when you inspire, it will collapse slightly, and when you expire, no air will come out of your mask. This is an N95, and it's only supposed to be used, I know you've seen different things on the media lately because of COVID-19, once only for each patient. This is another N95 Piper mask, okay? And this does the same thing, okay? So when you have a person on airborne isolation, they're in a negative pressure room, you wear an N95 mask, gown, and gloves with every entry into the room. Examples of disorders that are considered per the CDC, airborne isolation candidates, so to speak: TB, measles, disseminated herpes, chickenpox, and of course, recently, COVID-19. The next type of isolation that we have is called droplet precautions. Now, droplet precautions are disseminated when the patient coughs, sneezes, or talks. So it's in larger droplets. And what is protective for us as healthcare providers for this type of isolation precaution is either the surgical mask. These are all surgical masks, okay? And I'm going to put one on and show you how to properly put one on. Surgical masks, again, provide barrier. So if somebody sneezed on you, that's a barrier, so you won't get it in your airway. But it really prevents, that's why we're using them with COVID-19. If we're contaminated with something, it's going to prevent the person around you getting that contaminant or that communicable disease. So with droplet isolation, you're going to wear a surgical mask. These are different types. You're going to wear gown and gloves when you go into the room with every entry. And examples of things that are considered droplet isolation are H1N1, influenza, whooping cough, also called pertussis. These are examples. Strep throat, mumps. These are all things that are in the category of droplet precautions. The last type of isolation category are contact precautions. What this means is that when I come in close contact, 3 to 6 feet of the patient, there is something from their skin surface or some sort of secretion that if I come in contact with it, it's communicable. So for this, you're going to wear gown and gloves. Now, contact precautions, examples of disorders or communicable diseases that fit in this category according to the CDC are MRSA, methicillin-resistant Staph aureus, Clostridium difficile, vancomycin-resistant enterococcus, CRE, hepatitis A. So these are all examples of what would be considered a potential contact transmission. So I've already talked about all the masks. The other thing that you may need is complete coverage, like in Ebola. Ebola is droplet, believe it or not, but also complete coverage. So you'd wear a hair bonnet. You would also wear a booties on your feet. And you may wear a gown or what we call complete coverage. Okay. This is like a suit. This is what you should wear for that, complete skin coverage. And you'll learn more about that in disaster nursing. Now, the other thing that I want to talk about is if you have a blood spill, which is potentially contaminated, if the person has hepatitis or if the person has HIV. These are blood spill kits. They have Clorox in them, and you would put it into the blood spill and gown and glove, and it goes into a special biohazard bag. There are different sizes of biohazard bags. This is a smaller one. This is a larger one. Again, anytime you put something in a biohazard bag, it's got to be double bagged. So if I'm in this room and I have a biohazard material, the person on the outside of the room has gloves on will cuff the bag, and I will put the contaminated bag into that bag, and then it will stay at the door and then get picked up and put in a biohazard container. There are also special biohazard bags for chemotherapeutic medications, which can be very toxic to the skin. The biohazard bag that you will use a lot as a nurse is a specimen biohazard bag. The specimen biohazard bag it's kind of twofold. The specimen will go inside of this bag, and then it has an outer pouch where the paperwork will go. Okay. The other thing that I did not show you is the face shield that our college makes here. This face shield, which you would use for COVID-19, fits around the head this way, and again, it's that droplet splash protecting, being a protective barrier. Okay, now this is my isolation unit. And in this isolation unit, whenever you come upon an isolation unit, typically there's some sort of signage on the outside of the bag, outside of the room, that alerts you that there is a problem in here with droplet isolation. Of course, no diagnoses or anything can be listed. And it even tells you what you need. Now, this particular patient here has influenza. So as I said before, definitely I always have my hair back, so excuse me, I forgot to do that. But before I go into an isolation unit, let's say that if the patient was just being admitted and I was the nurse, I would call and get an isolation cart. It would be here, and in the isolation cart are all kinds of things. It's preloaded. It's got the signage tags, it's got some biohazard bags, it has gowns, it has mask, gloves, it has everything that you need, as well as dedicated vital sign equipment. We don't keep bringing equipment in and out of the room. We bring in a disposable blood pressure cuff, a stethoscope, a disposable thermometer, also a disposable SpO2 prong. Everything is dedicated to them and stays in the room when we initially admit them. The other thing is that if the patient has Clostridium difficile, C. diff, that's a spore. So a spore can only be killed by bleach or autoclaving, right? Steam, gas. So bleach wipes are used for a patient who has, even though it's contact isolation, gown and gloves, Clostridium difficile. Also, we have Sani wipes that we utilize in the patient's room that, if you look at the label, it really kills a lot of things. H1N1 influenza, it even says here human coronavirus. So this Sani cloth is used for all other communicable disorders, where we might clean equipment, clean on the inside of the room. And housekeeping now does a really major terminal cleaning for patients on a daily basis inside of the room. So I'm getting ready to go inside this isolation unit. So what I'm going to do is, I know that I need to wear a gown, gloves, and a mask. The patient has influenza. So what I'm going to do is I'm going to put my mask on. Whoops, over here, so sorry. Now when you put a mask on, this is a really great mask because it's water resistant, all right? When you put a mask on, you want to make sure that it firmly fits here, right? There's a little metal piece here that form fits, okay? To be perfectly honest, we don't use a lot of masks with ties anymore. They all have these elastics for the most part, okay? And you want to make sure that it fits down over your chin, right? To protect your airway, your mouth. All right? Now, the first thing that I normally put on when I go into the room is I put my gown on. I always wait and put my mask on last because I like to breathe fresh air for the most part. But it doesn't really matter what order you put it on, just get it on. It does make a difference when you take off contaminated equipment. These gowns are water resistant, cloth gowns. And it was interesting during this COVID pandemic that I saw a lot of hospitals using these, and I'm fortunate that we had them because right now getting a paper gown is almost impossible. What you want to make sure is that you tie up the top and that you close the gown together to protect your clothing. Now, if you're a really large person, you can put one on backwards and then another one forward on top to protect. There are also paper gowns that are disposable that you can put on. These paper gowns, okay, same principle, has two ties, has a cuff on it, okay, and the gloves go over the cuff. Those gowns are rip-away gowns, so you can rip them off and take them off with the gloves at the same time. Especially the, what we call the plastic water-resistant kind. They can come right off. All right. So now remember, when you take care of a patient in an isolation unit, you want to cluster your care. You want to ask them if they need anything before you go in. And pain medicine, water, you want to bring in what you need for the day. You want to multitask, and you don't want to hang around too long. You just want to do the care, kind care, of course. But again, probably not talk about the football game while you're in there and what have you, especially if it's something like influenza, okay? This does not fit so well over my cuff. It's okay. All right, so I'm going to bring everything that I need into the room, the cart, and you're going to don your PPE. Yeah, PPE is called, right, your mask, your gown, your gloves, anything else that you need, shield, what have you, before you go into the room. So now I'm going to go into the room and you swipe your patient. Hi, my name is Evie and I'm here to collect that urine sample that you had. I'm going to check. This is Mackenzie Gray for safety purposes. Give me your name and date of birth. Remember, each room will have a computer, so you can get the date of birth right on the computer. Do not bring in paperwork, your own paperwork, into the room, okay? Do not keep bringing in vital sign equipment. It's already in the room. You can see here we have a disposable stethoscope. We have a disposable blood pressure cuff, disposable thermometer, and this is an SpO2 prong for measuring oxygen saturation. So everything should be in the room, okay? So I've identified my patient, explaining the procedure, making sure my patient is safe. And now I'm doing my thing in the room, getting things done, whatever it is that I need to do. So now the patient, I'm going to the patient's bathroom, making sure the patient is all okay. And when I go to the patient's bathroom, remember, you're going to take off contaminated garb inside the room, not outside the room. Otherwise, you're going to contaminate people outside of the room. So what I'm doing here is that I have a specimen bag, and I'm going to place the patient's urine sample. Now, typically I have another helper helping me to double bag this, but there's another trick that you can do as well, because normally what I would do is I'd ring the bell and I'd say, I have a specimen. I need somebody to get a bag on the outside of the room so I can drop it in. So what I'll do is typically I'll go to the door's edge and drop this in, okay? Now I'm getting ready to leave the room, and I want you to try to visualize that I have contaminant on my hands, on my gown, and on my mask. So if you think about it, large mass of contaminant, my hands do a lot of the work, okay? So what you need to do is untie the center of this. You can see the end, okay? All right, I'm not gonna touch up here, right, with influenza microbes. So now what I'm gonna do is, this is probably the most contaminated area. So remember, you always take your clean glove off the center, roll it, go under, and if I have a lot of contaminant on my gloves, not that the CDC says this, I'm gonna wash my hands in between, okay? With waterless soap in the room, okay? Now, if I had goggles, I would take those off next, or the shield, but I don't have those, okay? So now this big mass of contaminant is coming off next. My gown, gloves, gown, and then mask, okay? So now what I'm gonna do is I wash my hands, so I'm gonna untie it here. And again, this is why nurses have their hair up. And what you do with this kind of gown that is reusable is you let it roll off. And you only touch the inside, and then you drop it. If it's a really contaminated room, then you're gonna wash your hands right in between. Now the next thing that you need to do is take your mask off. Never touch it here, because it's been filtering microbes. What you want to do is you want to touch it by the string like this, or the tie if you have an old-fashioned tie one, okay? And then you want to drop it in the trash, and then you leave the room. Remember, the most contaminated area is a 3 to 6 foot distance. So while this isn't a true patient room, I'm really close to the doorway, probably 12 or 15 feet away from them. There's a sink, so that if this is Clostridium difficile, we do not use waterless soap. Clostridium difficile has spores, and you can't wash the spores off with waterless soap. The only thing that gets them off is a lot of friction and warm soapy water, okay? So if this was a Clostridium difficile, you'd wash your hands with soap and water. There's a basin, there's a hand basin right by the door, and then leave the room. I think this is the end. Thank you very much.